When patients come into the office and have advanced prostate cancer, they often ask, how long am I going to live? And I have to say that's a really difficult question. And so if you're asking your doctor that question, it's an absolutely appropriate question and a good question to be in communication with your doctor about. But your doctor may or may not be able to give you a satisfying answer, and here's why. At this point, we have so many treatment options available for advanced prostate cancer, and we use them one after another to really string along the effective therapies that we have, and new therapies are always being developed. And we don't have great data to show us how long men can live if they're getting all of the treatment options that we have available to us at this point. We sometimes estimate that an average might be around 3 years or so, but that's an average. And so this is the other piece that makes it really difficult to judge for one patient how long he may have to live. Because an average number, like 3 years, doesn't describe people who live much longer, and there are patients like that. And it doesn't describe the people who have prostate cancer that doesn't respond to anything and that end up passing away very quickly. And so there's really a broad array of how people can respond. And I think the best answer I have for people is, let's see. Let's start a medication and see how you respond. And if your PSA falls dramatically and is undetectable, it's very likely that we're going to have a potentially prolonged response to that particular drug, meaning that you may be on it for months, years plus, and that would be phenomenal. But there's no way at this point for me to know who will respond to which medication and for how long. And if there was, I could answer the question much more easily. And we're always working to develop what we call biomarkers, or methods to indicate who will respond to what. They just don't exist yet. So if you ask the question of your doctor and want to know how long do I have to live, be prepared that he or she may not have a perfect answer for you, but hopefully they'll be able to explain at least the thought process behind why they don't have an answer.